So I feel like it was a productive morning, lots of good ideas, lots of good information shared, and we'll try to continue that for the afternoon. So we're right about on time, so I think we'll get started up. So I should say in the agenda that's printed and in your folder, that was an early agenda, sort of like our juvenile justice system. It's still under revisions. We don't have a data panel. I'm not doing a data panel this afternoon. We have a second keynote. But with that said, I will share a few statistics about our juvenile justice system here in Michigan, for folks who don't know. We have 83 juvenile justice systems here in Michigan, one for every county, so that makes things complicated. Here's another statistic for you, 0, as in no one could tell you how many kids were arrested this year. No one could tell you how many of the kids who were arrested this year were also arrested last year. And no one could really tell you of those who were arrested this year are likely to be arrested next year. And that proves complicated because, you know, when we think about policy reform and programs, we're largely operating in the dark, right? We don't really know much about what programs are working, how many kids and families are moving through the juvenile justice system. We do have a sense of kids, adolescents who are formally processed, so that's about 8,000 a year in the state of Michigan. But as this last panel talked about, we have really robust diversion efforts going on in the state. It's really our main innovation in juvenile justice in the last decade or so. But no one really has their arms around how many kids are in these diversion programs, which ones are working. But in terms of those who are formally processed, so about the 8,000 a year, 61% have a history of child abuse and neglect. That means there was an investigation into the home for child abuse and neglect, so 61%. And on average, these kids have had about 8 investigations. So it's not that, you know, the Department of or Child Protection touched that child or family once, repeatedly, and for long stretches of time, on average about 8 years. So if we think about, you know, the juvenile justice system, if we back it up, a lot of these children and adolescents have a history of state contact with the abuse and neglect agencies. In terms of education, folks have raised questions around education. The 5-year high school graduation estimate for Michigan is 79%. So 79% of high schoolers in public schools in Michigan graduate within 5 years. It's about 43% for adolescents who are involved with the juvenile justice system, and it's about 24% for adolescents who are involved in both the juvenile justice system with a history of child abuse and neglect. So it gets down there, and for African American youth, African American males in particular, it goes down to 15%. So if you think about high school graduation as an early achievement that builds onto a lifelong careers of success, we have challenges with system-involved youth and getting them through the public school system. And one of the things we ought to think about is whether or not our systems of care contribute to these lower graduation rates, right? Is formal involvement and all the requirements that come along with it decreasing someone's likelihood of finishing high school? So that's just a couple of statistics from Michigan. So I'd like to introduce our next speaker. Marc Schindler is the Executive Director from the Justice Policy Institute, a national research and policy organization focused on reducing the use of incarceration in both the juvenile and criminal justice system. The Justice Policy Institute is in Washington, D.C. Marc has a long history, I'm not calling you old, but a long history working around juvenile justice issues. I worked for the Department of Youth Rehabilitation Services, and he served as a staff attorney with the Youth Law Center, a national public interest civil rights law firm focused on protecting the rights of young people in the juvenile justice and child welfare systems. Marc is a recognized expert on juvenile justice. When we were putting together this conference on Raise the Age, we were looking for national speakers to complement our local talent. And since Marc has a recent publication called Raise the Age, it seemed like a good fit. So in reading that publication, there's a statement in there that says 7 states are ready to make the shift. So in May, when this publication came out, 7 states were ready to make the shift in terms of raising the age. We're now down to 5. We look forward to your second edition when we are at 4, and we've been taken off that list. Lisa Greco, she just came up with a great idea, was Lisa. She's taking a pool on whether or not Michigan will be next or last in terms of leaving that list. So place your bets in the back. So without further ado, Marc, welcome.
Right. Thank you, Joe. I appreciate the introduction, and my kids say I'm old, so I don't know, I'm used to hearing that. Thank you again for having me. It's really a pleasure to be here. I appreciate the invitation from the School of Social Work and being hosted here at the law school. So I'm just about to celebrate or come up on my 25th reunion from law school. I don't spend that much time in law schools anymore, so it's nice to actually be in a setting, sort of, back in a law school. But I'm curious, like if I'm up here in this position, do I get to I don't know how many law students out there. I know we've got social work students, we've got a couple law students, so I can ask you questions, right? I can just sort of call on you and we can get into the Socratic method a little bit. So it is a pleasure to be here. As Joe said, I'm with the Justice Policy Institute. We're a national organization that works on these issues. We've done work with lots of folks here in Michigan over the years, and it's really a pleasure to be back here talking about this important issue. I'll put my money in on the pool before I leave. I know Michigan's always trying to get into the Final Four, but hopefully not in this situation. Sorry. So, real quick, just to expand a little bit on my background, I come at this from the perspective of somebody who had been a longtime advocate in juvenile justice. So I started my career actually working for the Department of Probation in New York City in an alternative program for kids who would have otherwise been locked up. I then went on to serve as a public defender representing kids in juvenile court in Baltimore for many years, and then, as Joe said, I was with an organization called the Youth Law Center litigating on behalf of kids who were in facilities, working on racial disparities in the system. And then actually a strange thing happened in Washington, D.C., where I live. A number of us sort of reformers and advocates got appointed to run D.C.'s juvenile justice system. Right? So I had literally gone from suing the system, literally, on one day, and the next day I was the defendant in the case, right? Because I was running the agency and trying to turn around. It was a very troubled agency in Washington, D.C. that had overcrowded facilities, horrible conditions. Folks here are probably familiar with the stories over the years about the Maxey School, which I think also had very serious conditions. Our facility was similar. And so I spent about 6 years helping to run that agency, serving as general counsel, chief of staff, and ultimately as director. So running a system. I can definitely say, particularly for the lawyers and social workers in the room and the advocates, it's actually a lot harder to run the system than sue the system. Right? And I know there's some folks out here who run systems, right? And I appreciate both of those efforts. So today I want to talk a little bit about the report that we issued this past year that looked particularly at this issue of raising the age. And I'm going to share what we found. We were asked to do this, and we thought there was a need because there were, as Joe said, about 7 states who were still grappling with this issue of whether to raise the age of juvenile jurisdiction, but there had also been a whole bunch of states over the last decade that had done this, had raised the age, either from 17 to 18 or 16 to 18. And so we thought, why don't we sort of try to inform this discussion and say, well, what happened in those states, right? How did it work out? Did it cost a bundle of money? Did crime go up? Was the system overwhelmed? Like, what happened? We actually now have about a decade's worth of experience and data to answer the questions that I'm guessing are being asked here in Michigan as you consider this question. So I'm going to share sort of our findings from that report. Before I get into that, though, because I'm going to share a bunch of data, right? And you've heard a lot of data already this morning, and it's really important to understand and be informed by the data. But I also want to just sort of emphasize, when I was here for the panels and the presentations this morning, and I thought, as somebody was commenting, we really got sort of an excellent foundation laid between the science from Professor Keating and the presentations that were made about how the system works and doesn't work, right? But what sticks in my mind was, a couple of things that were said, particularly, I think Deborah LaBelle's comments. Like, just think about the fact that we're, talking about, as I heard it, 90% of the young people in adult prisons here have been sexually assaulted, right? Those are real kids, young people, right? And like, what's going on in their life after that? 90%. And then that story that was told, we shouldn't make policy decisions based on anecdote, but we should also pay attention to anecdote, right? Because that's powerful and important, and we can't forget those voices and those experiences. So, a 17-year-old who has sex with a 15-year-old, right? And the next thing we know, because the adult system tends to sort of eat kids up and chew them up, spit them out, we've now got somebody facing life without parole, right? Somebody who, I think by all measures, if we did a risk analysis, was not a high-risk young person, right? And so I think we just have to remember the individual impact that this happened and what's happening to kids in the system. So with that, let me talk a little bit about the experiences that we've seen around the country with states that have raised the age. And this report talks about shifting to a safer and more effective juvenile justice system. And the reason we named it that is what we saw is that states that were grappling with this issue, they were doing it in the context of larger reforms of their juvenile justice systems, right? There was actually a report that was issued by the National Academy of Sciences, right? The National Research Council of the National Academy of Sciences, which is one of the most respected scientific bodies in the world, right? And they looked at the issues of juvenile justice, and they said that what we should do is tailor our systems to the developmental needs of kids. There was a lot of talk this morning about developmental growth and adolescent development, and the world's best scientists said that's the way to think about juvenile justice, and they actually identified this issue as the way to think about a developmentally appropriate juvenile justice system is to have kids in the juvenile justice system. It's not really rocket science, right? They actually talked about that based on brain science, based on the research that we know now, we really have to think about adolescence, as was stated this morning, going up to 24, 25, right? And so I would venture to bet that if the folks who created the juvenile court in 1899 knew what we know now based on the science, they probably would have set the age at about 24, right? Not at 16 or 18. Right? So we just have to think about those things. And as we looked at states, we saw that the experience was that they pushed forward with this reform effort about raising the age in a larger context. All right. And, what I also want to share is this shouldn't be, I know we have a very partisan country right now, this shouldn't and doesn't have to be a partisan issue, right? So around the country, red states and blue states are taking on this issue. Right? So here we have Louisiana, right? One of the reddest states we have, and the governor of Louisiana, John Bell Edwards, talked about the fact that raising the age based on the developmental research was critical because now they can hold youth accountable for their actions in age-appropriate settings, right? So that's the governor of Louisiana. Blue state, New York, right? Governor Cuomo, New York was one of those states just over the last few months that raised the age, right? So of the 7 that had not raised the age, New York and North Carolina were the last 2 states that automatically prosecuted 16 and 17-year-olds as adults, right? And New York and North Carolina were the 2 states this year that raised the age, right? So that amounted to a lot of kids who were being automatically prosecuted as adults. And, you just look at what Governor Cuomo said, right? It took 12 long years to raise the age in New York. I'm not sure how long you've been working on it here in Michigan. But this year we got it done, right? And he said this state says no more to the cycle of madness, right? And so I think we have to embrace that and think about what we're seeing in these systems, right? And then we cannot lose sight of the kids who are locked up and remember to hear those voices. So here's a 17-year-old in jail in Missouri. Missouri actually has one of the most acclaimed juvenile justice systems in the country, right? They're viewed as doing some of the best work with kids in their juvenile justice system. And it's hard for me to understand that there's still a state like Michigan that treats 17-year-olds in the adult system, right? And so here's a 17-year-old in jail in Missouri, and he or she actually knew that the services that were being provided in the juvenile justice system were ones that they could benefit from. But here they were, sitting in a jail, feeling like they'd been written off. So why have states considered this and pursued raising the age, right? We found there were a number of things, and I don't think any of this will surprise you, right? One is, it's actually just safer for communities, right? So what we know from all the research, and none of the research statistics were referenced this morning, kids who are charged in the adult system, we know this is incontrovertible research. Kids do better in the juvenile justice system than they do in the adult system, right? So similarly situated kids, this is Department of Justice research, similarly situated kids who are prosecuted as adults compared to their counterparts in the juvenile justice system, they reoffend more often for more serious offenses and more sooner upon release than kids in the juvenile justice system, right? So when we're talking about public safety, this quite frankly is a no-brainer, right? It will make our community safer. It's also safer for young people, right? I'm not going to repeat what you heard this morning. I mean, Deborah LaBelle's comment about what's going on in these facilities, we know that to be the fact, right? Kids are much more likely to be sexually and physically assaulted in adult prisons and jails, and the trauma that is experienced, and these are kids, again, you heard it this morning, these are kids who are coming from a lifetime of trauma. What's literally the worst thing we can do to somebody who's experienced that trauma? I'm in a room full of social workers, I don't have to tell you that, is re-traumatize and put more trauma on them. That's exactly what the adult system does. So it's not safe. We also heard about the Prison Rape Elimination Act that now requires, finally, for kids in the adult system to be separated. And the adult system really struggles with doing that. And what happens oftentimes is they end up in segregation, very limited programming, right? So it's not safe for young people. It's also better for young people. Right? The outcomes that kids get in the juvenile justice system are much better than we see in the adult system. We were talking about this at the break. I was struck it was a really good conversation that we were having this morning in the panel. But this isn't the first time I've experienced this. I think, most of us here in the room, I think, would think of ourselves as child advocates, right? And there's a lot of experience in this room about working with young people, whether it's in the education system or the juvenile justice system. My guess is there's probably fewer people in the room here who work in the adult criminal justice system. Actually, I'm curious, show of hands, how many people here work in the adult system? So just a couple. All right, I'm glad you're here. The conversation this morning, in some ways, we were doing a little bit of beating up on the juvenile justice system, right? And that's fair. Right? I've sued juvenile justice systems around the country. They are not perfect. But when we compare them to how they do in terms of outcomes in the adult criminal justice system, particularly for kids, there's really no comparison, right? So if you want to put your money in a system or on a situation where you got a better chance of a good outcome, you're going to have that young person in the juvenile justice system. It may cost a little bit more in the near term, and I'll talk about that. but it's going to be a better investment, right? So we know that it's better for young people. And finally, just fairness, right? So it came up earlier. I'm really glad it came up. You cannot have this conversation without talking about race. It's impossible, right? Anytime you talk about the justice system, the history that we have in this country cannot be forgotten, and it impacts what goes on in the system, the decisions that get made every day, whether it's implicit bias or not, impact what goes on in the system. And what we see on this particular issue of kids going into the adult system is that kids of color, particularly African American youth, are overrepresented in the kids that end up in the adult system, right? So in fact, the deeper you go into the system, the greater the disparities are. So when we did our research, we saw that literally in every system around the country, kids of color were being disproportionately transferred to the adult system compared to white kids. Here in Michigan, I looked up the numbers. Somebody might have said this already. 59% of the kids who end up in the adult system here in Michigan are African American, even though they represent only 18% of the kids in the youth population, right? So really drastically overrepresented. It's just not fair. And when I think about this issue, one of the things I think about is, if we could, just try to imagine, I'm almost like, close your eyes and imagine if the disproportionate number of kids locked up in the adult system in Michigan were white, middle, and upper class kids. Can you even imagine it? Right? I mean, it's just like you can't, if it was, it wouldn't be allowed to continue for a day. Right? They would be outraged. Things would be done. We wouldn't be talking about money, right? If it was my kids that looked like me, right, we wouldn't be having this conversation, right? So we have to grapple with that. I mean, there's no question that every issue we deal with in the juvenile justice system and the adult criminal justice system is a racial justice issue. And this issue particularly, right? And we heard about the history this morning of how the laws changed over the year. The Willie Bosket case that Professor Vandervoort referenced in New York, that was all about race, right? And I'll commend an amazing book to you by Fox Butterfield, former reporter with the New York Times, right? He tells the story of Willie Bosket, right? What actually happened. Willie Bosket was the kid, if you don't recall, who I think it was 15 or 16 at the time in New York City, got released. He had been in on a homicide, got released, and killed a police officer, right? New York State literally went into special session in the state legislature to change the laws so that they could prosecute kids in the adult system, right? Fox Butterfield, went and looked at Willie's life history, right? And he wrote this amazing book about violence in America and the role of race and how this plays out, right? So it turns out that Willie Bosket's father was serving a life sentence for murder in the New York State system. It turned out that Willie Bosket's grandfather had served a life sentence for murder, right? It turns out that Willie Bosket's family had come from, when they finally got to the United States, a county in South Carolina that in the colonial period was the most violent county in the country, right? The most violent county in the country. Now at that time, was it black folks committing crimes? Anybody have a guess? No, right? It was white landowners that were committing crimes both on the people that they owned, their slaves, and each other, right? And the concept, who's familiar with the concept, and the kids, I don't know if this is sort of out of favor a little bit, kids refer to I was dissed, right? What is that short for? Disrespected, right? Fox Butterfield tells the story. Where do you think that came from? That term evolved from Edgefield County, South Carolina, where Willie Bosket's family had come from maybe 100 years before, and it was a legal defense for white landowners when they were charged with homicide to come into court and say, they disrespected my wife, right? And that was a legal defense, concept of disrespect. And so he traced it over the years, how that concept has now grown. And it was part of a community that was wealthy and white, right? So anyway, I just shared that. It's a fascinating story, and I think, again, the concept of how race interplays with these issues cannot be overstated. We have to think about that and grapple with that. Okay. So 9 of the states that once automatically excluded kids from the adult system have now changed their laws over the last decade, right? And that's great news, right? Because that means the number of kids who are automatically prosecuted in the adult system has now gone down dramatically, right? So here's a graph that shows the decrease in young people automatically excluded from juvenile court. And this goes to 2014. So this doesn't actually even include New York, North Carolina, and actually we're still waiting for the numbers on Louisiana and South Carolina. But we can see back in 2007, we had about 175,000 kids who were being prosecuted in adult courts around this country. And fast forward to 2014, that's down to 90,000. The numbers should come out again in the next year or two. New York and North Carolina, remember, those are the last 2 states that prosecuted all 16 and 17-year-olds as adults, were the bulk of those 90,000, right? So the numbers are much lower now. So Michigan, you better hurry up and change your law, because now you're becoming, in some ways, a really embarrassing minority in this equation, right? Now, we also found when we looked at what happened in these states is that at the end of the day, when these changes were made, they were largely bipartisan, right? Folks did come together around this issue. Didn't happen overnight. In a number of states, it took many legislative sessions, but at the end of the day, it was bipartisan. It was clearly supported by the research. And an important point that I'll get into more is that a lot of the concerns that folks had about what was going to happen to raise the age actually didn't come to fruition. Okay, so let's talk about the concerns that folks have had. If we raise the age, what will happen? Costs will go up dramatically. Anybody hearing that in Michigan? Yeah, okay. Juvenile crime will go up because we're not pounding away at those kids. We hearing any of that here? A little bit? Not so much, okay? The juvenile system will be overwhelmed. Juvenile confinement will go up. We're hearing some of that. Okay. So this is basically what was going on in these now 9 states. This is the conversation that was happening. People were saying, we're not going to be able to afford it, right? The juvenile justice system, it's much more expensive. We're not going to be able to afford it. We're going to be overwhelmed. Crime's going to go up, right? And there's going to be so many kids locked up that we're not going to be able to manage it, right? So we wanted to say, all right, what happened in these states? Did it happen? So let's look at the first one, costs, right? So here's Illinois, right? Another Midwestern state. What happened? They raised the age in 2 phases. I don't know if that's being considered here. So in 2010, they raised the age for misdemeanors, and then in 2014 for felonies. And initially, there were concerns that absorbing the misdemeanors would overwhelm the system, right? And they projected a 35% increase in youth into the juvenile system. Never happened, right? You can see, basically stayed flat. And because there were funds that had been set aside for the misdemeanors, they were able to actually move forward to phase 2, 2014, and raise the age for felonies. Since then, not only has the juvenile justice annual budget stayed about flat, there were also, and I want to emphasize this, there were costs projected at the county level in Illinois. Does that sound familiar to, all right, the county level? So Cook County, Chicago, right, largest county in Illinois, they believed that it was going to cost them just under $1 million in additional courtroom resources, probation officers. Those were court costs that they were projecting, about $1 million. Didn't happen, right? The system essentially right-sized itself, right? And I'll talk more about that in a minute. So that's in Illinois. Massachusetts, another state that raised the age. They projected an increase of about just under $25 million, right? And that was for probation officers, judicial positions, court clinicians, and about 197, just under 200 additional secure beds. So they said, all right, we're going to do this. It's going to cost about $25 million. Now, they didn't let the money stop them. They did pass the law, and they raised the age, right? So what happened? Did they have to spend $25 million? No, right? They ended up with an increase of about $15 million, 37% less than their projections, and they managed it, right? So what we found is it doesn't cost nothing to raise the age, right? So let's not kid ourselves, right? It doesn't cost nothing, but in each of the states we looked at, the projections were much higher than was actually realized, right? So as I said, I spent some time in government. There are other folks here in government and people who work with the legislature. How many folks are familiar with fiscal impact statements, right? Oftentimes when there's a bill that's pending, they ask for a fiscal impact statement, right? Has anybody ever done a fiscal impact statement? One person back here. Anybody else? We got one. All right, we got an expert in the room. Let me tell you my experience with fiscal impact statements. It may be different here in Michigan. Not necessarily the most rigorous analysis that we would want, right? We definitely want to look at this issue because when I was a government official, I wanted to know how much is it going to cost. I got a budget I got to manage, right? So I want to know how much it's going to cost. But we also know that they're made on a lot of assumptions that may not play out, right? Quick aside. So I've been out of the DC system now for 7 years since I was director. They were struggling with the same issue in DC. So we've got kids who are charged as adults who are housed at the local jail, bad conditions. And the council wanted to put the kids in the juvenile facilities, right? Much better conditions, not perfect, but much better, right? And they said, how much is it going to cost to move the kids from the jail to the juvenile facilities, right? And the fiscal impact statement was $42 million. This is for about 20 kids, right? I said, $42 million, wow, that's crazy. And I live in the district, I pay taxes in the district. I said to my council member, they should not spend that money. Like, that's crazy, you don't need to spend that much. And he said, well, where did they come up with the 42 million? He's asking me, and I said, well, I can guess, but I'm not sure. Let me check. So I actually had a conversation with the staff person from the chief financial officer's office who did the fiscal impact statement. Very nice, smart guy. And I said, the council member asked me to look into this. How'd you do the fiscal impact statement? He said, well, I called over to the agency and I asked them, based on this, how much will it cost? Now, this was my old staff who I used to run that agency. And I said, well, what'd they say? And they said, well, we got this many kids in our custody now. We expect it to go down, but we got to play it safe, so we'll probably have to build another facility. And I said, whoa. They wouldn't have said that if I was still the director. The numbers are going down. And so I said, oh, now I know where they got the number. So we had built a new facility 6 years before because the old facility was horrible and everybody said it needed to be closed down. So we had built a new facility, 60-bed facility, long-term commitment facility, one of the better ones in the country. How much do you think it cost? 42, right? So that was the fiscal impact analysis that they had done. Now, Michigan may be much better than DC. The guy I was talking to was a smart guy. He had checked the numbers, right? Oh yeah, they did spend 42 million. I said, that's not the way we should be figuring out how much this is going to cost, right? So we actually need to push on this issue. Now, I understand there's a fiscal analysis now, a study being done that the state has commissioned here in Michigan, which is good, right? Because we do want to know roughly how much it could cost, but let's push on those projections and make sure we're getting solid analysis. To me, that analysis should allow for a conversation, right? It shouldn't be the end of the discussion. All right. Last one, I think Connecticut is one of the states that maybe Michigan has looked at a little bit. Again, the projections just didn't come out the way they thought they were going to come out. So they originally projected that it would cost $100 million in implementation and sustainability costs, right? Between 2001 and 2012, their spending in the juvenile system actually dropped $39 million, and they took a good portion of that money and reallocated it to community-based approaches. So I heard a lot of discussion this morning, like, can we invest in prevention? God, we better be doing that, right? That's actually what Connecticut has done. Like, they took the savings and they invested in prevention, right? And so their dispositions fell by 34%. They ended up closing a detention center during that time in New Haven, one of their largest cities. They saved $3 million there. So as they reformed their juvenile system, they were able to improve it, make savings, and it just didn't cost what they had projected. And in fact, Connecticut's really interested, and no other states that I'm aware of have looked at it this way. So when Connecticut raised the age from 16 to 18, what the governor has done and his staff, they actually started to do analysis on what was happening in the adult system with the young adults, right? So over the years, since like they raised it in 2007, like what would have happened, those kids who are now in the juvenile system, who would have been in the adult system, right? We know what the data says, they're less likely to reoffend. And so what they saw is that they actually have savings now in the adult prison system in Connecticut because their 18 to 21 population has gone down, right? To the tune of a 51% decline in the number of young adults in the adult system during that time. And they believe they saved about $58 million annually in their adult system. Now, can they make an exact correlation and say, we save this money because of this? They can't, right? Probably some more research can do that. But they are saying, wow, this is interesting. We thought it was going to cost us $100 million in the juvenile system, didn't cost anywhere near that much, and we've saved money in the long term in the adult system, right? So again, we need to sort of think about these numbers in context. So it didn't cost as much as folks thought it was going to cost, right? What happened to juvenile crime? Do we have a juvenile crime wave in these states? Actually, no. Interestingly enough, and this is the first few states that raised the age, their decline, so we know juvenile crime across the country has been declining over the last 10 years or so. The states that raised the age, their drops were larger than the national average. So not only did they not have increases, their declines were bigger than in states that hadn't raised the age. So Massachusetts, so you know, about 29% decline over this period of time since then. Massachusetts, 48%, and this book breaks down both property and violent crime. Connecticut, huge declines, and Illinois, right? So these first generation of states, they actually outperformed the national average in terms of crime decline, right? Now, they were also worried, were their facilities going to be overwhelmed, right, in the juvenile justice system? I think you guys are sort of getting the theme on this, right? Didn't happen, right? They actually reduced the number of young people in their facilities over that time. Pretty substantial declines, and again, outperformed the state average, right? So Michigan during this time, I don't have Michigan's numbers, but probably somebody here does. Michigan has done pretty good in terms of reducing the number of kids in secure confinement in the juvenile justice system. These states who raised the age have actually done better, right? So think about that. Massachusetts also, you can see the numbers decline, and there's Illinois, same thing. Some sort of relatively flat, right? But again, didn't overwhelm the system managed. Some challenges, right? But they had good folks working on this. I encourage you to talk to the folks in these states. They'll happily share what their experience was and how they managed the changes. So what we found basically is states can do this, right? You can do this. It's the right thing to do. What were the strategies that they used to actually get here, right? And so we identified 7 strategies that were going on in states. Some of this they were doing anyway. Some of this they did specifically to try to manage this issue. And we identified these 7 strategies, right? So the first one, it was discussed this morning, expanded the use of diversion, right? So for example, in Louisiana, their largest, in Louisiana they call them parishes, created a school-based restorative justice program that diverts kids. They diverted 500 kids from juvenile justice and kept them in school, and that allowed them to manage this issue in their jurisdiction, right? Improving probation and aftercare approaches and making them more effective, right? So New York City just raised the age. As they were sort of having this discussion, the New York City Department of Probation, which is their largest in the state, they changed to a strength-based approach, and by 2012, their violation rate was 3% compared to 11% statewide. And that's why they feel like we can do this, right? We can do this. Mental health, right? A lot more emphasis using better instruments and starting to provide mental health services outside of secure care in the communities. So these states, they had this in common. For the most part, we're doing better in that area. Right? Pretrial detention. Who's heard of the Casey Foundation JDAI initiative? Right? So a national initiative to reduce the use of secure detention was present in all these states. I think is in Michigan too, yes? Maybe? But you guys actually, I think, have done pretty well on this, maybe on your own. Pretrial detention was reduced substantially. So, for example, in Mississippi, JDAI expanded to 5 counties, and they reduced secure detention by 65%, right? And so that gave them more capacity in their juvenile justice system to absorb those 17-year-olds, right? And so JDAI is part of this story. They reduced reliance on their secure facilities, and they shifted resources to community-based approaches, right? And so I talk a little bit about that in Connecticut. A number of places reduced their length of stay, right? PREA, we talked about that earlier, right? This is the law, the federal law that came into effect that required states to, when you have kids in the adult system, to keep them sight and sound separate, right? And there are sheriffs in each of these states who will tell you, I wouldn't have been able to comply with PREA if I still had those kids in my facilities, right? So PREA actually they used as an argument to say, you got to move these kids out, right? We can't do it. So you had sheriffs from counties around these states making that argument, and that was deemed to be something that was helpful both in terms of making the changes and a reason to make the changes. And then finally, improving their management of resources within the juvenile justice system. Now, I ran a system, I feel like we improved our management of resources, but we weren't done by any means. This is something that we should all be working on moving forward, and these states showed that as they improved their management of resources, they were able to create a more developmentally appropriate system that helped them absorb these kids. And that includes things like using better risk instruments, using structured-based decision-making, so if a kid screws up, he doesn't automatically go right back into a secure facility. Those are the types of things we saw, right? So now the big question. Is Michigan ready, right? So when you think of those 7 strategies, right, and we looked at this a bit and talked to folks here in the state, and there are people in this room who know this better than me, but based on our assessment is that Michigan is expanding the use of diversion, right? Has done a lot of work on that in recent years. In fact, I think I can't say it better than one of the speakers on the next panel, who's sitting right here, right, who says, I'm not going to say it for you. You can read what Mr. Gonzalez said. Like, you guys are doing it in your county, right? And this has been very successful, right? And I don't think you're the only county doing expanded diversion in Michigan. So Michigan is seen as a place, yep, you're doing check, right? Addressing youth's mental health needs outside of the system. Wayne County is actually viewed as really a leader in this, right? I know there's been privatization, there's been things that have been done here that you're not sending as many kids to the state system, anywhere near as many years ago, and part of that is expanded mental health services in the county, right? And I think Berrien County has also done a bit of this as well, right? If I'm right, partnering with law enforcement, mental health, and child welfare, right? So I got the head nod there. And I think Berrien, so I'm looking at my numbers, 2001, 125 kids in out-of-home placement, and 2015 down to 40. I'm not sure what it is today. Under 40, right? So you're doing this in Michigan, right? So check on that one. And similarly, reducing reliance on facilities, shifting resources to community-based programming, right? That's happening, right? You've got a cost-sharing approach here, right? So that's happening. And generally improving the management of resources. Again, not a job that is ever finished, but I think it's fair to say, particularly over maybe the last 10 years or so, Michigan is doing better on this, right? In fact, Michigan is a place that when we were in DC, we actually came to Wayne County and had discussions with them about how did you shift the resources away from secure confinement into community-based programming. So Michigan is viewed as a place that is doing well on this, right? So my conclusion, other folks can challenge me, is that based on what you've done so far, right, I don't think there's any question that Michigan is poised to join these other states. I don't think there's any, it's not like these other states have done it so much better in these strategies, right? Again, it's not perfect. You have to think about what's the alternative. The alternative is an awful alternative, right, of having kids in the adult system that is worse for public safety outcomes, harms kids, and is just incredibly racially biased, right? So if you stack up like those reasons compared to the work you're doing in the juvenile justice system, can you do this? I don't think there's any question. Yes, Michigan, we believe, is ready to raise the age. Not that it's going to be without some challenges, right? It will take some things to do. So what can Michigan do? Because we also talked to states about how they did it and what advice they had for others who were considering this, right? So one is, I would encourage you to look at those 7 strategies, right? I did a quick analysis, but there are folks in this room and others who can really dig into those issues. Where are we on those 7 strategies, right? I think what you'll find is we're making progress. There are certain areas that we want to highlight, right? So I would assess those strategies. The really cool thing right now is we've got now 7 states with 2 more that were just added, but just let's think about the 7. There are now folks around the country who have absolutely done this, right? And for this report, we went and talked to pretty much all of them in every state, right? And they are a wealth of information, right? They've been there, done that. They struggled, they figured it out. They are now amazing resources to places like Michigan to come and talk to your agency administrators, right? If I was doing this in DC, I'd be calling my colleagues in Massachusetts who I know and say, hey, can we meet? Can we get on a conference call? Tell me how you struggled with this. What'd you do to do this, right? They can also talk to legislators, right, to share their experiences. And I think this is something that I think we really need to tap into now, right? Because I think so far they've sort of been isolated, but now I think there's like a growing community of folks out there who are proud of what they've done and happy to talk with others about it, right? And the last thing is sort of similar is there's technical assistance. Actually, the federal government is now funding technical assistance through the Department of Justice. Hopefully that will continue to assist states who are considering and then implementing Raise the Age. So there's actually assistance that can be provided. So all that to say, I think there's a real opportunity here in Michigan to move forward. And then the last thing, I'm not sure why I felt sort of the need to refer back to our former president. I just sort of like to remind myself of that, but this is not a partisan presentation at all. I was just sort of struck by this comment that President Obama made a couple of summers ago in July 2015. He was the first sitting president to visit a federal prison and meet with the folks who were there. And I think his comment here just sort of, to me, captures what this is about, right? he's talking about it from his perspective, right? They made mistakes, some really bad mistakes, right? And did, cause some real harm. But they're not that much different than the normative behavior. Everybody's hand went up, like particularly when we talked about 17, I was like, oh yeah, 17. I remember that year. But they had supports, right? They had the types of things, second chances, right? And sometimes we need third chances, right? But to me, this was just sort of captures sort of the essence of this conversation. So I just wanted to share that. Questions, follow-up, this is where to find me. I should have referenced, you actually do have the executive summary of the report in your packets, so the graphs and things that I shared, and it's online at our website, and happy to talk further. So I really appreciate your attention today. Look forward to the conversation continuing, and if there's anything that we can do to answer some more questions as you move forward, we're happy to do so. But I will make my bet when I leave. I'll go to the pool somebody's ready to take my money up here. And again, thank you for your attention, and I look forward to the discussion. And I think we have some time for questions. Is that okay? Great. Answered all the questions, I guess, right? Right here, yeah.
I think the big problem in Michigan has been the lack of resources at the county level. Mm-hmm. And that is something we need to solve, I think. And I was wondering, are there any of the other states that have successfully dealt with that?
Yeah, I mean, there's different ways, and I know there's been some of that here, and there are others here who are more expert in the room about the cost-sharing model that shifted money from the state to the county. So there's a history of it here, at least to build on. Illinois is an example. Illinois did something called Reclaim Ohio and Redeploy Illinois. Right, and so they had an act during this time where the counties were incentivized, right? So if you don't send a kid to the state, you get X dollars, right? And if you send a kid to the state, you actually get penalized, right? And they shifted some money to the county. So there are examples of that. Again, this is not new to Michigan, because as I understand, part of the way that Wayne County has kept kids in Wayne County. No? I thought there was some shifting that went on some years ago, but I could be wrong on that. Got it. Okay. So yeah, there are Pennsylvania's another state. To any of the counties. Yep. So yeah, I think there are a number of states that use different type of fiscal mechanisms to keep the money local, and that's helped. But I don't want to sort of get stuck too much on that, because I think, what we found in the research is it actually didn't cost anywhere near as much as folks thought it was going to cost. So my guess is there's probably enough money in the counties right now to start to take this on, and maybe it's a phased approach, right? Maybe they should think about, phasing it in and monitoring it and seeing how much it actually costs. So yeah, there are states that have done it, but I think the strongest point that I want to make is just let's be sure that we're not thinking it's going to cost an arm and a leg, because it just hasn't. So back here.
Hi, my name's Roger Manella. I have a two-issue question. The first issue is, before people get into, especially adolescents, get into the juvenile justice system, there should be some education of them and their parents about their rights, and some advocacy besides just getting a lawyer once they've been charged and are in the court system, to educate them about alternative programs and other kinds of things. I know that I worked as a school social worker. I know that in the school, if we advocated for a kid that maybe there was a zero tolerance violation or, truancy or something, we could keep them in the school. And we even established in the school what was called a second chance program, where kids were too disruptive during the day school. The school was kept open later, and they could come in the afternoon and evenings. The second part of this is that you mentioned Maxie. Maxie has been defunded and closed, and mental health services for adolescents are hardly existent. They're certainly more non-existent than they used to be. And without those alternative kinds of diversionary services, everything devolves to the juvenile justice system.
Yeah. So excellent points. I mean, I think so two thoughts, right? One, we talked about, like, you can't have this conversation without talking about race. You also can't have this conversation without talking about other important youth-serving systems. And the two biggest probably being education and mental health, right? And so we have to make sure that we're reforming those systems to the extent they need to be reformed and focusing our attention on that. It did strike me, I can't remember if this was mentioned in the data, there's actually a relatively small number of 17-year-olds in state prison in Michigan. Is that right? Like, I heard roughly 50 or so, right? So I don't want to minimize that, right? Because I don't want any of those young people in a state prison, and we heard what types of things happen there, right? But there's many more 17-year-olds who are in the community on adult probation, right? Who have education needs, mental health needs. Like, what are we doing for those young people, right? And again, the juvenile justice system, not perfect, right? But at least the juvenile justice system is trying to do something positive for those young people, right? We heard the programs that were referenced. Like, why don't we build on that? If we spend as much time sort of building on improving those supports and services as we do sort of thinking about, the 50 kids, right? We should just make that decision quickly and then do the real work, right? Which is the points you made. So I agree, absolutely. It's part of a larger reform effort.
I was just going to make a comment. Working in Chicago in 2005, 2006, in the community mental health, we actually did start new teams, mental health juvenile justice teams, and we went out using kind of like the assertive community treatment models, but again, with children impacted in Cook County, south side of Chicago, and again, putting those resources back into, we took families grocery shopping, we took kids to get stuff for school, whether it be clothes or supplies, and seeing the difference that putting the money there opposed to putting the money in Cook County, again, it works. It makes a difference, and in the middle of Chicago in 2005. So just kind of adding to it.
Absolutely. Just a quick point on that, and I should have mentioned this. This is actually since we did the report. So as I said, Michigan, you're one of the last 5 now. You're in danger of falling further behind. There's actually other states, Connecticut, Vermont, and Illinois, are talking about raising their age to 21. Right? So those are states that recently raised their age, and now they're saying this works well, we want to go up further, right? And in Cook County, specifically in Chicago, they are experimenting with restorative justice courts in the community, right? And will refer to those types of programming. So that, I think, is something worth looking at. I'd love to see you judge in a restorative justice court, like in the community. That'd be fun, wouldn't it? That'd be great.
Oh, okay. So although there are only 50 kids in the prison, there are children in jails all over the state, many of which are not PREA compliant. So I think it's really important to raise up those kids also. And to the point earlier that Joe Ryan made, we don't even know how many of those kids there are because we don't have good data. So So I want to say that.
Yeah,
But
absolutely.
the other piece is that I wanted to talk about and ask you about is, we've done exactly the opposite here in Michigan. We've actually incentivized sending kids to the state, and you heard some
Right.
examples of that from the panel.
So then the county doesn't have to pay anything.
Right, so we've
Right.
got that flipped on its head. We do predict that there will be some initial costs in implementing this.
Yeah.
We also are really committed to making sure that the juvenile courts are able to continue to provide the really good services that they do provide, right?
Right.
So we're not interested in getting into arguments about what that actual cost is. What I'm more interested in trying to figure out is what's the mechanism? Like, what is the mechanism to be able to make that shift
Yeah.
in a way that's going to allow the counties to continue to provide those services, that they're not going to be harmed by it, right?
Yeah.
Which would then flow down to the kids.
Yeah.
So what's the mechanism? And
And-
that's the question.
And when you, let me make sure I understand, when you say you're not talking about the fiscal mechanism. You're just,
I'm talking about how do you set up funding for this kind of a shift in such a way that the counties are not going to be bearing the brunt of it in a way that's not financially sustainable? Because we have to do this.
Yeah.
And there's so many smart people in Michigan. I'm convinced we can figure it out.
yeah.
But I just was curious if you had any thoughts about it.
Yeah, different states have done it different ways. Every state is unique, some counties, some state unified, right? And so we didn't find any one place, we just talked about the shifting of the funds from the state to the county and have a formula. So different places do it differently, but what we did find is this was the commonality, right? That there were strategies. Now, it didn't have to be every single strategy, I should make that point, right? But there was work going on in this way. And so I think the way to think about this is, what are we doing in terms of these strategies? Again, it doesn't have to be every single one. How is that impacting our budget, right? Because these will result in savings, right? So if we do more, you may not have maxed out on your diversion. I don't know, maybe you have. Not yet, right? So there's still some savings there that we can think about. How do we shift over here? So I would encourage, again, I don't think there's any one mechanism, but I would encourage you to talk to the folks around states, and we're happy to give contact information. But I think, our sense is looking at these strategies and doing an assessment, right, of where are we on each one, including what are the fiscal implications, and can we go further?
There's an irony to me as I listen to you speak when we talk about doing things that are smarter, make communities safer, are better for kids, better for families, and we have prosecutors who dismiss these strategies under the guise that by being tougher on kids, by punishing them, by locking them up, by incarcerating them, that they make safer communities. And I think as taxpayers and as citizens in a community, we need to have a very active dialogue with our prosecutors.
I agree.
If I was a prosecutor and I evaluated my effectiveness by the number of convictions that I got, the number of juveniles I put in prison, and then see the horrible outcomes of what happens to those kids,
Yeah.
I couldn't face my constituents because the evidence is very clear, both fiscally, what's in the best interest of these children, and so I'd be interested to know what have been the conversations that have occurred post Raise the Age with those states, and particularly their prosecutor community, and
Yeah.
that have been very anti this initially.
That's a really good question. I actually want to tie it back. I'm glad you made the point about the kids in jails, because I would not want to forget those kids at all. And I'm curious because I think what we saw in a number of these states is that the sheriffs were allies, right? Because my guess is the sheriffs who run these jails, is it sheriffs here in Michigan? My guess is they don't want those kids, right? Because operationally, it's a nightmare, right? Because they, generally the sheriffs want to keep people safe in their jails, and it's really hard to do. So I think the sheriffs, that what we've seen is in other states is their potential allies. Now, of course, my sense is sheriffs hang out with prosecutors, right? So what's the conversation going on the law enforcement side of the aisle? Now, we have seen in some states some prosecutors have stepped up. It's interesting, what I think has happened in most of these states that have changed the age, I think the prosecutors just sort of went on and they're doing their business. Like, we're not hearing huge outcry from the prosecutors because, they were saying the sky's going to fall in, and it didn't. So, I don't know, they may be on to the next thing. But we should explore it because there's actually there's a couple of groups now that are doing some good work with prosecutors. And so I think it's a conversation worth exploring, like how's that happening at the national level in that community, and can we encourage some local folks because it may be part of the conversation at some of the national organizations.
Yeah, we definitely need to get on that because my understanding is in Wayne County, the law enforcement community is dead set against this. And if they were aware of this information, Alvin, you just made a fabulous point. I mean, we've been sold that tough on crime is what tough on crime, tough on crime, tough. We're starting to learn with the brain science and everything. We need to start being smart on crime. How about that for a concept? Because absolutely, I mean, law enforcement, you got to think it's not just about getting notches in a belt. It's what's good for the community. And I'm willing to bet that there's a fraction of the people that are against this that have any idea of these results. Right. So I'd be happy, maybe we can pull some people together. I think we should have a press conference. We should get the media working on our side to get this message out there.
Oh, I just was going to add to that because I think there's more than just the prosecutors. There's a public perception.
Yeah.
Because I know that long ago when we tried to reduce overcrowded, training schools and stuff like that, the public either loved you or hated you. And so there was like no in between. So this is sort of like one of those love-hate things. There are some that are going to really appreciate this, but then there are some that are going to do the fear factor, we're more in danger.
There's the one thing I'll say on that quickly is we now, maybe not in every state, but we do have good public opinion polling on these issues, and the public generally does support prevention and rehabilitation, and the public really does not want to have kids in adult facilities, right? And that score is high in every category. People do not want to have kids at risk, and they kind of get that. They understand that putting a kid in an adult jail or prison, right, that's not going to be good, right? So in some ways, the public is on our side on this.
Good afternoon. My name is Hannah. I come from Spain. I am a lawyer. And for me, talking about prosecutors is very interesting because in Spain, and my brother is a public prosecutor there, they are not elected democratically. They have a very hard exam, a competition, and a lot of exams. So they are not exactly devoted to their electorate. Yeah. They are devoted to their work. And I know from my brother and a lot of people around me, because I have judges in my family, etc., they are devoted to their work, and it is a call, a vocation, Yeah. So perhaps could be a kind of, not solution, I don't know, but I mean, it's not like being elected. For me, it's very interesting to know that can be someone is not a civil servant in that position, but a democratically elected.
Yeah, I mean, I think it's an important point. I mean, the fact that prosecutors are elected officials makes this very difficult. I don't necessarily see a movement afoot to have them be appointed, but the fact that they are elected makes it very difficult. That said, we are seeing some progress in challenging prosecutors, right? So it was mentioned earlier, overwhelmingly, prosecutors across the country are white, not necessarily representative of the communities that they're serving, and overwhelmingly, incumbent prosecutors are not challenged in their elections, right? So they almost always run unopposed, and just in the last 3 or 4 years, there's been efforts now to challenge them, right? And so Cook County, there's like 3 or 4 jurisdictions where the prosecutors were defeated for their sort of just tough on crime, not smart on crime. So there's some opportunity there, I think.
So my name is Ava Adler, and I'm a retired social worker. I worked in foster care, addiction, child neglect and abuse. And I guess it's an interesting time to be talking about this because, as we know, in this time where our country is completely divided in exactly what we're talking about, and fake news, gets people really scared and fearful, and we have at a federal level, we have things going the opposite direction. But I'm trying to understand how come Michigan ended up on this shameful list of 5. What happened? What's happening in Michigan? Who do we have to get this information to? You're talking about the prosecutors, the legislators. What happened?
Yeah, unfortunately, I don't think I could answer that question for you. I think that's a question for folks here in this room. And the bigger point you raised about what's going on nationally, I don't know how much time we have, but that would take, yeah. Yeah, I think that's a question for the next panel, actually.
Hello,
Yeah.
I'm Roxana Duntley Matos. I'm the president of the Organization of Latino Social Workers of Michigan, and I'm also the community liaison for the Child Trust Fund, which tries to prevent child abuse and neglect of Michigan. And first, I'm honored to be here. I'd also like to thank Dr. Robert Ortega, my mentor of over 20 years now, for this incredible presentation and outstanding comments from the audience. I have 2 comments, and I also want to thank our colleague from Spain, because brought back to my memory the comment I wanted to make in the first part. One of our colleagues in the audience made the comment that she didn't understand why, at a global perspective, people were addressing policy in such much more effective ways than we are in Michigan. And my experience in social work, in the Council of Social Work Education, actually brought that question to my mind and an answer, and our colleague from Spain did as well. I was a member of 2 committees in the Council of Social Work Education. One was the Council of Global Learning and Research, and the other one, I won't mention the name, but it was one that was sort of primarily based with members of the United States only. Now, the one on global research, although all our faculty across the United States, they were members from many countries and were engaged in constant research with other countries addressing policy and alignment constantly. So they were constantly having to think out of the box. The other organization was their vision was very much around the structures that they are familiar with in the United States, and had very difficult times trying to get out of that and moving into collaborating outside of that perspective. I'm going to put it that way. So we really do need to engage as a state with other states and with other nations around this. So I think that as social workers, we have to really reflect about ourselves. Let's look at this audience. It's wonderful to be around such incredibly sort of outstanding, out-of-the-box thinking colleagues. But we're all social workers. We're in a school, what, of law? How many lawyers are there? How many prosecutors are there here? It goes back to the comment of our colleague over here. Let's go to the press, let's go to the prosecutors. But if we as social workers cannot get our audience filled with people from other disciplines, we're perpetuating the same kind of dynamic. And so we really need to get out of that. We in the Child Trust Fund know, and we're collaborating as a state, proudly so, with ACEs. Everybody here knows what ACEs is, right? Adverse Childhood Experiences. The new research is coming out. That should be affecting policy in so many ways, prosecution especially. I could go on and on. I could tell you a program that we did in Flint, outstanding results with juveniles who became heroes. It was shut down as soon as it was successful because of all the bureaucracies and the perspectives that are in place that are so hard to move because we don't have other perspectives coming in to challenge those. So our challenge here in social work is to bring non-social workers into this, to fill this room. Because again, this has been an outstanding panel, but if it's just us, we're the choir. Thank you.
I don't think I could top that comment. So. It's nice to be a lawyer to be with social workers, but any other? So, whoops. So I'll just leave you with the information there. So for folks who are on social media, feel free to follow us. We like to share the information and appreciate. I think part of what we need to do is amplify and broaden this conversation to others, and so social media is one way of doing it. So I encourage you to follow me, follow my organization, and share this information to others. So with that, I'll thank you for your attention and look forward to the rest of the conversation.
That's great. Thanks to Marc and for everyone who is contributing to the conversation. We're going to take a quick break, I think. Maybe a cup of coffee. What's that? 2:45. 2:30. 15-minute break. That's enough. Quick cup of coffee, and then we'll come back.